بسم الله الرحمن الرحيم. الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to our free webinar, Balagh free webinar, coronavirus outbreak and our Islamic guidelines. So just before I get into the details of what this webinar is all about, I'm just going to outline a basic introduction to what we are planning to do, inshallah, in the next 1 hour and a half. So initially, we all have some kind of awareness about the coronavirus or COVID-19, and it's clearly having a major impact on our communities, on us as individuals, and it's been taken from a number of different perspectives in terms of how it's affecting us spiritually, psychologically, and physically. So the purpose of this particular webinar is to address a couple of things. Before I mention that, I think it's important that I will outline the objectives of what we're trying to achieve today. The first is that there is something called infodemics. And what that really means is that whenever we are inflicted with such pandemics like the coronavirus, in situations like that, what tends to happen is, especially with the kind of social media platforms that we have today, there is a lot of misinformation, there is a lot of sort of propaganda, there's a lot of claims that are made by many, many different people. And sometimes it's very difficult to differentiate between the truth and what is falsehood. So this is an opportunity for you all to sit down with some of these experts who can give you a very good insight, not only to the details of what actually is important regarding coronavirus, but also to educate you about what we should be doing as Muslims, as individuals, as families, or as a community. So let me first begin by introducing our panelists. So in essence, we have, first of all, I will start off with Shaykh Yunus Dudhwala. Shaykh Yunus Dudhwala is the head of chaplaincy and bereavement services to Barts Health NHS Trust UK. And he is also the director of HMC. We also have Dr. Muhammad Munir, who is a lecturer in biomedicine and has expertise in COVID-19, and this is at the Lancaster University, UK. So Dr. Muhammad Munir has been on national, international TV, sort of talking about this issue in quite a bit of detail amongst many different sort of channels. Then we have Dr. Aasim Padela. Now, Dr. Aasim Padela is a bioethicist, an academic, also the director of Medicine and Religion program in Chicago, USA. We also have Dr. Rania Awad, and she is the clinical associate professor in psychiatry and behavioral sciences at Stanford University School of Medicine. And finally, we have Mufti Zubair Butt, somebody who we recognize more so for his latest fatwa on organ transplantation, which the NHS has sort of uploaded onto their website for all to view. So, alhamdulillah, we've got, as you can see, quite an audience here. So our audience, in actual fact, reaches approximately 800 people who have registered, but we probably will see as the session goes along, quite a number of people will start coming on board. So I can recognize we've already got over, I think, maybe 100, 200. We've got 200 people already online. So inshallah, we're expecting more than that, probably double or even triple that amount, inshallah, as we go through the session. Now, just to also emphasize that this audience that we have is not just the UK, but we've got it from over, I think, 35 different countries. So majority of the audience is from the UK. So we've got quite a diversity of geographical areas all over the world. So this gives us a real opportunity to start really addressing important issues related to COVID-19 from quite a global perspective. So inshallah, what I will try to do is I will try to keep it quite straight to the point, make it succinct, and address majority of your questions as well. So what we're going to do, we're going to spend about 45 minutes asking our panelists a couple of questions, and then what we will do then is the remaining 45 minutes, I will open this out to the audience, and then this will be an opportunity for you all to ask your questions, inshallah. Okay, so let's get down to the general detail. So let's just first realize and appreciate that COVID-19 is something that's become a major part of our lives now. So, you know, there are many, many different messages that are coming out there. It's not clear sometimes what those messages are. We're getting sort of contrary messages or contradictory messages here and there. So we've got Dr. Dr. Munir, sorry. So Dr. Munir, there seems to be a lot of hype about the COVID-19 virus and the infection. Now, is this hype justified?
Oh, yeah. Thank you very much, first of all, having me on this panelist. That's wonderful. First time opportunity to interact with such a wide audience and really to contribute to the society. So in scientific history, we have seen two kinds of diseases. The first kind of disease is the one that are very lethal. For example, Ebola virus. So more than 80 out of 100 infected people could die, very lethal. And then we have seen other infections. Those are less lethal and have literally no impact onto the casualty. They don't kill the host, in our case, in the human. So the first one, the first category, always short-limited. The one that is highly lethal is short-limited. They go very quickly because viruses need us to survive. The other category, the one that does not kill many people, they are really not bothered in the society because they are not of that concern. Unfortunately, this COVID-19 has found a middle ground. So it is highly contagious. It is spreading between people quite effectively, but at the same time has a quite good impact, or in other words, worse impact onto the health. What we have seen so far, the countries, those have taken very drastic measure right at the beginning of the time. 7.7% of those who were infected, they were died. But then the people or the countries, those were really late in taking those actions. Over there, the case fatality rate is really high. For example, in Italy, 10 out of 100 infected people have died, which is really serious. So just putting into the whole context, this virus got some unique features. And our understanding in the scientific community is that it is here to remain. It is not short-lived. It's a long-lived and has certainly impact.
Okay, Dr. Munir, we recognize, I mean, it's something we're quite familiar with. We're, the common flu, and we recognize also that it kills, quite a considerable number of people all around the world. But why are we getting told that our hospitals are not going to be able to basically react to the demand that is expected of them? With this particular virus? What makes this virus so different relative to the others?
Yeah, well, you mentioned about influenza. Certainly influenza is one of the biggest burdens actually in our healthcare system. But since it became seasonal, so every year it comes, so hospitals are relatively prepared for it. They know in winter it's gonna come anyways. And with the influenza, the case fatality rate is really low. Is 1 out of 1,000 people infected, they die. With the COVID-19, first thing is that we were not prepared. It just came 3 months before, and it has taken the whole world by storm. And also, the mortality rate is really high. I mean, compared to this one, it's like, even if we take the average of the whole global, perspective, 3 out of 100 mean 30 out of 1,000. If we compare with influenza, they die. So it has first very short history, unexpected outcome. The second thing is that it has quite high impact onto the case fatality and the deaths. So both of these came up like a surprise to us. Therefore, our healthcare system was not really prepared to cope with the burden of this disease.
So is there an issue about avoidable deaths? So there are clearly unavoidable deaths, and then we have this issue about avoidable deaths. And these are deaths, for the audience, that clearly, if we have all systems in place and things were functioning efficiently like they should normally, then those deaths could have been avoided. So are we in a state now where we're looking at a considerable amount of unavoidable deaths? Is that the issue? Is that the main focus of why we're panicking so much?
I think, unfortunately, that is the situation. But
Right.
it really depends. I mean, if you take the global perspective, different countries, they took very draconian and drastic measure right from the
Yes.
beginning. So they
Yes.
tackled very well. But the majority of the countries here in the Europe and including United States, they are relatively behind in sort of putting all the, eggs in the same basket, really tackle it. So over there, the chances for this one to have a lot more impact than other countries we have seen, like Hong Kong and Singapore. This is going to have a lot impact into many countries who took the measures really late, including many countries in the Europe.
So from this perspective, okay, let's look at UK, for example. What's the estimate of the number of deaths that are going to happen? Okay, so these are just estimates. We recognize that, and they're not completely accurate. Just in the UK, how many deaths are we looking at from COVID-19?
Yeah, so let me explain one term that called herd immunity. I think government in the UK has been working very actively to maintain the herd immunity. By herd immunity is that how many people in the population are immunized against the disease. Those people will be protected, and a fair proportion of people in the community, if they are protected, the rest will be protected, because virus would not transmit from immunized to unimmunized people. So government has been working on to underlying, the herd immunity. So herd immunity to achieve for COVID-19, which has a reproductive rate of around 2.5%, 60% of the population need to be infected to get the herd immunity. Okay. So 60% of the population in the UK mean 40 million out of 67 million, roughly. And if we look onto the death rate of this virus, which is, as I was mentioning, 0.7 to 10%, which is really big range. So if we take even a conservative approach, we are talking about 2% here in the UK. So 2% of 40 million, we are talking still about 800,000 people. So 800,000 people need to be dead to get a 60% herd immunity. But again, here a question comes: how drastic measures are put in place, and how much time they do consider to put in place. If they do so, then certainly this number will decrease significantly, and then the herd immunity would still be achieved, but the death rate would decrease significantly. But at the same time, if vaccine or therapeutic would become available before they reach 60% of infection in the population, then would also have a very high impact.
And we will talk about immunizations and various other things later on. But generally speaking, okay, so we recognize the scale of the concern in terms of the number of deaths we're looking at. I think we also recognize that this is mainly affecting the elderly and the vulnerable amongst us. So clearly, we recognize that this is very serious. Now, different countries are approaching this from many, many different ways. From your expertise, somebody who's really looked at this and you've dealt with this for some considerable amount of time in terms of the details, what's the best approach here? Should we press for draconian type sort of social isolation and distancing? Should we sort of try to take a balance? Like, for example, in the UK, we're trying to draw a balance in terms of the impact on all the different services and how that may even lead to further deaths because of some of the lack of services that we can provide, and poverty and various other things. So what's your take on this? What would you advise would be the most appropriate approach here?
Precisely. I mean, as some of you probably already heard today press conference by Boris Johnson. So they have estimated 1.5 million people in the UK. Those are falling within the vulnerable group, like
right.
having underlying causes or aged 70 plus. So this means that 1.5 million people in the UK, they are at a high risk of having bad consequences, really. So now what can be done to really minimize this impact? I think at this moment, especially when we talk about UK, the only thing that we can do, to be honest, is really to protect and shield this vulnerable community.
Right.
If we do so, then of course the impact would be significantly reduced, because we do know the younger people and also the children, they are not really that much affected. So our really main focus is on 1.5 million people who are really at that risk. Now the next question is how to protect them.
Right.
The first thing need to be done and basically need to be realized is that although young people, they are not under severe threat of this infection, but they are actually the main source of infection to the elderly people. So every individual in the society has now a critical role in not only minimizing the impact, but also ensuring that our elderly people, or the people who are frail or having underlying causes, they are protected. Because more we protect them, the higher chances are that we will have less impact onto their health, because then our healthcare system would really cope with them as we stretch the curve along the line. So I think what we are doing now at this moment is really to protect that vulnerable community, really ignoring the other, but everyone has to take the responsibility.
So, Dr. Munir, just give us 4 ways that we can protect ourselves and our families from coronavirus.
The first and the most important thing is staying updated with the latest information. Okay. I always been saying is that this is a changing scenario, is a prevailing situation. Every country is taking daily basis as a new information is coming in. So if you are not, if
we don't know enough, there's still more information coming to us. Yeah,
precisely. Every day there is new information coming up, because even in the scientific community, we are learning on everyday basis, because this is a new virus, new disease. Countries are prepared at different scale. The first thing is staying updated with the latest information. The second important thing is really to ensure your personal hygiene. Washing hands, avoiding social gathering, and keeping everything tight and clean in the house, because some people don't really embrace and appreciate. There are tiny things that can make a big difference. For instance, the door handle in the main entrance of the house. This is something that will be touched by every member of the family. Okay, so this need to be clean and tight, kept clean and tidy. So the second option, the second thing that I mentioned is the personal hygiene. Right. And the third thing, probably the most important among everything, is that follow the guideline government has provided onto each and every step. For example, when we talk about UK, now there is a lot of recommendation ongoing at the moment, is that the social distancing, avoiding gathering, but at the same time, that is also confusing, because I was having conversation today earlier on the LBC radio, where people were asking, question about whether, well, the social gathering is discouraged, but at the same time, people are going to the parks and so on. Yes. So that's the fourth thing that is important, but that is down to the government to do so, is to have a convalescent sera. So that is the sera, or the blood basically collected from the people who are already recovered. Right. So as you know, by now, I think there are around 280,000 people infected. Out of that, like 90,000 people are recovered. I mean, I'm talking about the globe. Those people are having antibodies in the blood. So people who are recovered, if they volunteer to donate the blood, we can extract the antibodies out of that, and those antibodies can be used to treat the people who cannot survive otherwise, for example, underlying causes or elderly people and so on. The fifth thing, if I can really say so, is really to take care of every person in your neighborhood. Not only as being Muslim, because that's what we've been taught, but at this moment, beside every other race, religion, belief, whatsoever the color is, please do take care of every neighbor in your around. For example, I can give you my example. Today, myself and my daughter, we written my business card. On the back of it, that anyone in our colony, anyone need any help from us, we will be able to provide you. So we drop every card into the whole colony. We have like 70 houses. And some of them, they already know me over the media. So anyone who has confusion onto any point government is proposing, do talk to me. If I would know, I will tell you straight away. Otherwise, I will figure it out and come back to you.
Okay. Thank you very much, Dr. Munir. That's very, very useful. So in essence, we understand how severe the coronavirus is in terms of some of the death outcomes that we're expecting from it. We also recognize that there are certain things that we need to do. So there's something about social isolation and distancing. We also recognize that this isn't just something that is concerning for the elders, but rather everybody in the community has to play a role here. So we're looking at even the young, and sometimes the young could be quite sort of not too considerate of this, because their lifestyles are quite different from our elders. They tend to engage more, they interact with each other, but yet they could be bringing this disease back to their homes, to our elders. So let me turn to Shaykh Yunus Dudhwala. So we know this, and I'm sure that most of our communities, as I'm talking specifically about Muslim communities, recognize how severe this problem is. There is a sense of panic going on in some of our Muslim communities. Now, how is this affecting the Muslim community? How is it affecting each individual in the Muslim community? How is it affecting the families? What's the general feedback that we're getting in terms of how Muslim families are reacting to the severity of the coronavirus?
Bismillahir Rahmanir Rahim. So I think if we look at how this has been in the news for some time, and people have been watching it and saying that, thinking that it's at a distance, it doesn't concern us, it doesn't affect us. But slowly, we've seen how Saudi Arabia has shut down totally in terms of Umrah, in terms of Haram, in terms of Medina Munawwara Jummah this week. I mean, many of you might have heard the khutbah from Medina Munawwara and Makkah Mukarramah. And, you know, it's been devastating for those people who went for Umrah. Flights have been cancelled. So everyone's lives, whether they're Muslim or non-Muslim, has been affected. And in our communities, I mean, we've seen panic buying going on. Unfortunately, prices being risen, which has affected many families. And then we've seen our masajid and makatib being affected. Especially in the last week or two, we have had many masajid, especially when the schools announcement was made last week. The maktabs that are running throughout the UK especially have had to close down. Some will be carrying on online, inshallah. And then many masajid have had to restrict public access to 5 times daily salah. Only a few individuals are performing the salah. So everything is changing. Everyone's lives are changing. And I think from a Muslim perspective, our concerns will be that once the masajid have stopped public access and there's no Umrah, there's no spirituality, how are we going to keep that spirituality?
Yes.
How are we going to connect to our communities? And I think
before we go into the question of spirituality, there's always a very big concern about compliance. And is the Muslim community complying? Now, I was just listening to a very dear professor, somebody who I've been working at Bradford Royal Infirmary, and he's just put out a video. And when I was talking to him, he was saying that this video, I hope, reaches the Muslim community more than anyone. And that's quite interesting. He was saying that. And he was describing Bradford. So Bradford is an area where there's a cluster of Muslim, many Muslims around in Bradford. And there are, we tend to be very communal. We sort of regularly go, we've got extended families. Not only that, but we also have, my background is I was a commissioner, so I understand the demographics of places like Bradford. So even our morbidity rates. So morbidity is basically the number of disease conditions that exist in the Muslim community tend to be on average, in the UK anyway, higher than relative to some of the other communities. So, we're more sort of vulnerable to heart disease and diabetes and various other things. So also, the other issue is in terms of the fact that there is a frailty index that we look at. So, usually around about the age of 65, 70, people tend to be more frail when they go above that age. But this tends to happen at a lower age in, the South Asians, specifically more so in Bradford. So he's got a real concern. He thinks it's going to impact places like Bradford or clusters of Muslim communities in Bradford, many other places around the world, probably more so than any other community. So is our Muslim community, are they really looking at this realistically? Are they compliant with this? Are they socially distancing themselves? Are they isolating themselves? What's the general situation in the Muslim community at the moment?
Well, I think if you look at the queues in the shops and the shelves which have been emptied by the Muslim community, I don't think we've been very compliant so far.
Yes.
However, I think the more the messages are coming out, especially from the imams, especially from, Boris Johnson was very clear today that if people don't stop mixing, then they might have to put some powers in place. Right. So I think we as a Muslim community need to be at the forefront of understanding the severity of this illness, how quickly it spreads, Dr. Munir is an expert in this area. Yesterday when we listened to him, today when we listen to him, it's very, very clear. This social distancing, physical distancing is extremely important. And if we don't do it, we as a Muslim community are already being pointed fingers at for other reasons, unjustifiably. But this time it will be justifiable, and we will be picked upon very, very easily. As, for example, yesterday there was an article that 28 people who in West Midlands were tested positive. It came from a church. If one mosque is found to be the cause, that will be a field day for many tabloids. So we need to really, really adhere to the guidance that we are being given.
And recognizing there are certain cultures that exist with a lot of the South Asians, mainly I'm talking specifically about UK, but clearly we have different countries have different sort of ethnic backgrounds. But, you know, we have a culture of, you know, communally getting together regularly, you know, and so forth. So, you know, it can be very difficult to get the balance right there.
I mean, for example, I mean, let's look at today. In the UK, it was Mother's Day. Yes. But I saw many social media posts of my non-Muslim friends who are outside their mother's door, but they did not go and meet their mother, just talk to them from outside. They are adhering to the guidance. And yes, we also have we have a very strong culture of looking after our parents, looking after our families and staying with families. But this is a time that we really need to make sure that our health takes priority, because what will happen to families is that we will be distanced. As if, Allah forbid, anything happens, families will be distanced at the most important time of their lives, which is happening today in hospitals. Okay.
So I think there's something about mindset as well, isn't it, in terms of how we perceive this. Let me give you an example. I went to a masjid not too long ago, and there was one of the elders, and I was talking to him, and I was saying, look, you're frail, you're old, you should not be coming to the masjid, you're putting yourself at risk. And his response was, and I'm going to put this question to Mufti Zubair, his response was that it's all in qadr of Allah. Allah subhanahu wa ta'ala has destined my life or my death. And if I do die, I will be a shaheed. So this is the kind of response. And he wasn't the only one. I've had this from a number of different people. So there's something about understanding the depth of what the situation currently is. But we do have an Islamic tradition which tells us quite a bit about ta'a'un, plagues, and waba, epidemics. So Mufti Zubair, what's this thing about qadr? What we are destined, and the issue related to plagues historically. I mean, there are certain ahadith which mention the Prophet ﷺ advising us not to enter a place where there is ta'un or plague, and for those who are there to remain there. And to what degree should we consider this as rulings, or should we abide by this? How should we relate this to our theological beliefs related to the fact that our life is destined and our death is destined?
I think we were fighting there to unmute myself. Jazakallah for allowing me to share some thoughts with yourself. The issue of qada'ullah and qadar of Allah is, alhamdulillah, specifically, especially amongst our elder population, is quite a strong belief that they have. And that is a fundamental belief of ours. And this is no different for pandemics and other illnesses. ما أصاب من مصيبة في الأرض ولا في أنفسكم إلا في كتاب من قبل أن نبرأها. So before Allah brings it to being, Allah subhanahu wa ta'ala has already recorded it. So this pandemic that we have now, this was something that decided by Allah subhanahu wa ta'ala would happen in the manner that it is happening now. And that is the qada of Allah subhanahu wa ta'ala. And Allah subhanahu wa ta'ala, when He decides something, there is wisdom in what He decides. There is wisdom in what He decides. And it is not always possible for us to understand that wisdom. Sometimes that wisdom is found in something that we dislike. وَعَسَىٰ أَن تَكْرَهُوا شَيْئًا وَهُوَ خَيْرٌ لَكُمْ. Sometimes you dislike something when actually it's better for you. وَعَسَىٰ أَن تُحِبُّوا شَيْئًا وَهُوَ شَرٌّ لَكُمْ. Sometimes you love something, you covet something, but actually it's not really good for you. وَاللَّهُ يَعْلَمُ وَأَنْتُمْ لَا تَعْلَمُونَ. Allah knows and you don't know. So the hikmah of Allah subhanahu wa ta'ala, we don't know. I think initially when this virus started, it started in China. And initially to somewhat some kind of expression of satisfaction, Muslim would post that Allah subhanahu wa ta'ala is punishing the Chinese because of the way they have treated the Uyghur Muslims. I think that theory has probably been debunked now because the Haram is closed, Iran has been affected, Pakistan, India, all right, up to the entire world.
Yeah.
So I think that has been debunked. What is the hikmah of Allah subhanahu wa ta'ala? Allah subhanahu wa ta'ala says, Wallahu ya'lam wa antum la ta'lamun. Allah knows that you don't know.
Yeah.
Sometimes it can be as a sign of the power and qudrat of Allah subhanahu wa ta'ala that Allah subhanahu wa ta'ala can do what He wants. Yafa'allahu ma yasha. Allah does what He wants and we can't do nothing about it. Before Allah subhanahu wa ta'ala, we are helpless. How weak we are is simply a reminder. Sometimes it can be a reminder of Allah subhanahu wa ta'ala as part of the whole picture, bigger picture. Sometimes it can come as a punishment. It can come as a punishment. Aisha radiallahu ta'ala anha, she asked Rasulullah sallallahu alayhi wa sallam about the plague, about ta'un. And so she said, Rasulullah sallallahu alayhi wa sallam said that it is a punishment, أنه عذاب لا يبعث الله على من شاء, that Allah subhanahu wa ta'ala sends it upon who He wishes. وأن الله جعله رحمة للمؤمنين, and this Allah subhanahu wa ta'ala has actually made it a source of mercy for the believers. So for believers it's a source of mercy, and there's none that falls in this plague and then they stay in their place where they are, sabiran muhtasiban, observing patience and also knowing that this is from Allah and hoping for the reward from Allah subhanahu wa ta'ala, and also with the belief that whatever comes to us is from Allah subhanahu wa ta'ala, and what is written from Allah subhanahu wa ta'ala, and if Allah has not written it, it won't happen. That whoever has that with this, whoever bears it with this belief, then that person gets the reward of somebody who is like a martyr. So he gets the reward of being a martyr. So this is something that is the wisdom of Allah subhanahu wa ta'ala. We don't know exactly. Yes, it could be generally we say it is a punishment for our sins, possibly. With the there's a hadith of Rasulullah sallallahu alaihi wasallam said also that that when fahisha and licentiousness that is prevalent in society and it becomes something that you express openly, then Allah subhanahu wa ta'ala, He brings these kinds of calamities, brings these kind of things. So that is also a possibility. And also it can be that Allah subhanahu wa ta'ala is thinking that you have enough sin so far that I will punish you with this, and then you will do sabr on this and Allah subhanahu wa ta'ala will elevate our status. So we don't really know exactly what the hikmah of Allah subhanahu wa ta'ala is. But this idea that I'm going to continue go to the masjid and I will die is kind of idea of fatalism, which Islam doesn't. It's not something that Islam encourages or allows. Rather, we are encouraged to adopt the means to protect ourselves, which we have a duty, and Allah subhanahu then pray to Allah subhanahu wa ta'ala that He does protect us. Just to finish on that, I just quote one of the elders in England, who is in his older age, the father Mufti Muhammad ibn Adam, his father Mulana Adam. He said, and it's gone on, he said, spread on social media as well. He said that, for a long while I thought that I'm going to the masjid and Allah will protect me. And if I, I've spent my life anyway, and if I go as a shaheed, I go in the house of Allah subhanahu wa ta'ala, and so be it. But then after a little while I thought that whilst it may be okay for me to have this feeling about myself, it's not right for me to sacrifice the lives of others. Yes. Why should I get poorly and pass it on to others? So I may be okay for myself, but not to risk the life of others. So maybe you want to jump into, you have that kind of tawakkul that is beyond what is actually required of you, but don't sacrifice the life of everybody around you, just so you can be satisfied in your heart that this is something that I've done.
So in essence, this is a process that we understand here is that we are interdependent on each other to really beat this virus. So you can't take an individual on their own in terms of the fact that they feel that they can give their life for a cause. But reality is that we're all potential transmitters of this condition. And the problem is that, and this is the same point that Dr. Munir was raising, that, just because we have the elders isolated in their homes doesn't mean that, everybody else can go out and do whatever they need to do, because everybody is potentially somebody who can transmit this and cause some serious issues. Now, we will come back to the.
Dr. I think Dr. Munir will probably be able to verify this. I heard today that this virus is actually mutating, and it is not a case that the young are not at risk. We have a nurse in her 30s, Muslim nurse in Birmingham, who is now fighting for her life, as reported today. So it's not the case that, oh, if you're old, okay, it affects the old. No, it can affect others as well, and people. And she has underlying conditions as well. So I think we need to be.
So it can, clearly it can affect the younger ages as well. Okay, so we understand the theology, so the theological aspects of this. That I suppose one way of looking at this, that there are asbab, so there are means of dealing with this. One mean is a physical approach. Okay, so this is by adhering to Dr. Munir's advice, socially isolating ourselves, taking up personal hygiene, and sort of caring for our community. The second is the spiritual perspective, so the metaphysical, not the physical, but the metaphysical. And this is turning to Allah subhanahu wa ta'ala, asking for forgiveness, and also supplicating to Allah subhanahu wa ta'ala, because all this is all the qadr, is all destined by Allah. Allah has the whole power to control and to remove. And this is a very, very important aspect of our theological belief. So on that basis, you can't do one without the other. So both are very, very important. So we need to exhaust our physical sort of means, and throughout the whole process, rely on our spiritual, which means that we must turn to Allah subhanahu wa ta'ala and ask for forgiveness. Okay, moving on.
Just to continue that, Allah subhanahu wa ta'ala says, because it's important, I think if we are looking at this as a form of punishment, Allah subhanahu wa ta'ala says in the Quran in Surah Al-Anfal, وَمَا كَانَ اللَّهُ لِيُعَذِّبَهُمْ وَأَنْتَ فِيهِمْ. Allah subhanahu wa ta'ala will not punish them in a manner that He will totally obliterate them whilst you are, O Prophet, alive amongst them. وَمَا كَانَ اللَّهُ مُعَذِّبَهُمْ وَهُمْ يَسْتَغْفِرُونَ. And Allah is not to punish them whilst they are asking for His forgiveness. So one thing we need to do immediately is ask forgiveness from Allah subhanahu wa ta'ala for all our sins, and that's something we can do immediately.
So let me turn to Dr. Rania. Now, Dr. Rania has a lot of experience in dealing with the psychology of Muslims in particular. You also have an academic interest in these areas. So now, this is quite heavy stuff. It must seriously impact families. Considering the way we live, our culture. Isolating our elders. Putting them separately. Our kids are with us, all the schools are closed. Now we need to deal with our kids. At the same time, we have the pressures of dealing with other people in our homes, and it's impacting us financially because some of us are out of work, and we're not sure how long this will go on for. So, Dr. Rania, from a psychological perspective, also clearly understanding that we have a quite a different approach to psychology in our Islamic tradition. What particular, what's the current situation going to be that's going to impact Muslim families and homes with this infliction?
Yes. Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. First, thank you for having me on, inshallah, for this conversation. And certainly, as you mentioned, it is quite a difficult question. I think the first place we really need to start the discussion is really to understand what kind of emotions are showing up in our families and households. Probably two emotions more than anything else at the current moment. The first is anxiety, and the second is fear of the unknown mostly. And I think I'd like to start by really saying how important it is to emphasize that these are normal reactions at this time. There's a lot of concern about why, as Muslims, we're having these emotions, but it's actually, we learned that a small amount, a certain amount of anxiety is actually healthy. It allows us to kind of get able to take things when needed, like, as you mentioned, planning our families and work around our families, planning meals and essentials, activities with kids, figuring out how to work from home, alternating work, things of that nature. It's really when those emotions go overboard that become problematic. But it is normal to feel this way. And it's important to remember that Allah subhanahu wa ta'ala created these emotions just like He created any other emotion of happiness and joy or sadness and depression and whatnot. It's what's important here is what we do about them, inshallah. And I really want to, just mention too that unless families had a lifestyle in which the children were already homeschooled and parents were already working from home, this is a very strange and unique situation for many households, as you mentioned with our elders. And we're worried because many of us take care of multiple generations from children to elders, and we're trying to balance all in between. So I think that's the first place to really understand that this is a new territory, and some of these emotions are quite normal.
So just more specifically, the kind of advice that you would probably give. So, I mean, clearly, you're going to get quite inundated by a number of people.
Sure. Yes.
What kind of things are you going to expect? What's the kind of response you're going to get from these Muslim families? Is it going to be mainly? I mean, are you already getting those kind of responses? Are you getting trauma? I mean, I'm hearing certain individuals, even as a general practitioner, we're getting recurrent calls by my patients who are telling me I can't go to sleep. I'm panicking. I'm concerned for my family, and it's not just the patients. Even my own staff are concerned. So, and it's very unclear in terms of who's got it, who hasn't got it. There's no testing going on. So it really puts a serious state of panic. What particular advice would you give those kind of individuals who are really panicked by this, really anxious about the circumstance?
Absolutely. I think this is where, if I can put them into 5 steps that are hopefully practical in order to cope with anxiety that's coming up. And as you mentioned, it is across the board. And I think there are some people certainly at the front lines, our healthcare workers, for example, or those who are more susceptible, like our elderly. However, it's really, as you mentioned, affecting everybody. So the 5 steps that could hopefully, inshallah, be practical. Number 1 in this is to talk. And this is, of course, our field. We do a lot of talking and listening. And I think this is really important globally. The reason for that is the bottling up that I'm finding people doing, especially those who others are depending on. So the ones who are the caretakers of the families, they're kind of bottling up a lot of these emotions. But unfortunately, the situation is very overwhelming. And eventually, people will be overwhelmed too much. But if you were to talk to people that you trust and who are able to listen, and then also lend a listening ear to those who are most concerned. For example, our elderly, they may be, for example, isolated, but to be able to phone them or to do a video FaceTime kind of call with them really helps alleviate them to listen to actually what it is that's concerning them the most. Or those who are feeling that they do want to go out to the masjid, to explain and to hear why it is. A lot of times the underlying reason is actually a lot of isolation and loneliness. But if that was alleviated in other ways, then they wouldn't be putting themselves at risk in such situations as well. So listening, and also understanding that it's important to be flexible, that people are, that they show their emotion, like you mentioned, trauma or anxiety, in different ways. Not everybody shows them in the same way. So we should not judge or assume, and we should be or shame also is another concept that we're seeing a lot of at this moment. To be very supportive of each other is most important. Number 2 on this list of, inshallah, practical coping mechanisms is to really moderate the amount of news. Certainly we want to hear day by day what's happening, but I'm finding that people are very much too plugged in. They really are. They're being overwhelmed by the amount of news, and because we're a very connected society the way we are today, we're being inundated with information much faster and quicker than any other time in the past. And so this is really the time to turn inward as much as possible, because we are, at least here in the US, we're very much quarantined. Here in California, we're in a shelter and home situation. And this means that we are home with our families. And this could really be an opportune time to really turn it the other way, to spend the quality time with family members that we don't necessarily have the chance to do. And for people who have children at home, I think there's a lot of anxiety about how are we going to school them when schools are shut down. And really a reminder here that learning doesn't happen just in books and classrooms, but the best learning actually happens between the lines, as in to say, this is really a wonderful time to really talk about everything that the esteemed scholars before me had spoken about, really the concept of why Allah subhanahu wa ta'ala brought this to us and how he has the ability to bring us through this. And thinking about lessons from, whether you come at it from lessons of the seerah of the Prophet ﷺ and how his own parents were affected by the fever of Medina and both died because of it, leaving him twice orphaned, or whether you're thinking about it from a fiqhi perspective of why, it is that we're, in the adhan you tell people to pray in their homes. Many people were seeing this and were very surprised by it, but it's rules that are in the fiqh books. In the,
Dr. Rani, I don't want to push you, but if you can come to these 5 points, because I think they're very important. That you,
yes, exactly.
Key points are always an essential way of approaching some of these
Absolutely.
issues. If you just could tell us briefly what those full 5 points are, and then we will have plenty of opportunity to go into the details.
Sure. The spending the quality time with family instead of really being plugged in, I think, is a really key point here. Number 3 on this list is really taking time to take care of oneself. And I think that's a very important point of taking breaks, eating healthy, sleeping well, and engaging in spiritual practices, which inshallah we hope to get into in more detail.
Sometimes you can be so bogged down with everybody else in your family, you forget yourself. Yeah.
And taking that time, yes, absolutely, to really steal that time away, and to really, in other, non-Muslim practices, they talk quite a bit about meditation and whatnot, but we have our own forms of these things. And the tafakkur and tadabbur of really taking the time away and contemplating, this really helps bring anxiety down and bring the emotion of fear down as well. When you hold on to concepts like, la yukallifullahu nafsan illa wus'aha, that Allah is not going to burden a soul more than it can bear, and such spiritual aphorisms like this. Number 4 is to take action. Dr. Munir earlier was talking about how he went to his community members, and this also brings anxiety down quite a bit for people when they turn that anxiety into actionable steps. So figuring out who needs help in the community, who are the elderly that need phone calls or need grocery shopping, really helping, and having children also be part of this plan is really important. It brings their anxiety down too. An important thing we know in our field is that children pick up on our emotions. So anxious adults also make for anxious children. So if you're able to bring them into the action plans, it also helps them feel a sense of control and brings their anxiety down. And number 5 on this list is really getting help when help is needed, because not everybody's going to be able to handle the anxiety just from the first 4 things I mentioned. This is where the professional healthcare providers, mental health providers are really here to help. I know here at the Khalil Center, which is a Muslim counseling center, we have all of our sessions now converted into web therapy. And I know that our counterparts in the UK are doing the same. So I really encourage people to get that professional mental health help if they feel the anxiety is much too high that they are able to bear.
So in essence, there's a fear that sometimes you can internalize this so much that it can have a massive impact on you, especially when others are dependent on you, and then that will have a huge impact on the rest of your family. So these are 5 points that are very important for us to all take on board to ensure that we're protecting ourselves, not just physically, because physically is paramount, but also spiritually and psychologically. And that is something that we need to also take into consideration in circumstances like this. Now, Dr. Aasim Padela, I'm going to turn to you now, okay? And we're going to look at the whole picture of how Muslims are dealing with this, okay? So the Muslims have approached this issue related to COVID-19 all over the world. Different approaches from different countries. Some have been quite draconian in the way, shut everything down, socially isolate yourselves, close all the masajid. There have been other countries that have had a sort of not so harsh sort of approach to this. Are we doing the right thing? Who are we relying upon? Are we going back to our Islamic tradition? Are we being really heavily informed by what our Islam, which is very rich in the kind of knowledge on this subject? This is nothing new. There are many kitabs, books, in history written by some of our scholars like Ibn Hajar Asqalani, rahimahullah, and various other scholars about this. Are we heading in the right direction here? Should we be doing it this way?
Let me respond to that, but first saying that I want to thank all the ulama gathered and those who are here, I think 250 or so participants. May Allah subhanahu bless you all and protect you all and your families. And consider this time and time of barakah, and may He give you the peace and security in Him that you all are desiring. Jazakallah khair, Dr. Rafaqat, for asking the question. I'll answer it in several ways. First, I think that obviously I don't know what right direction is or isn't, right? Allah subhanahu wa ta'ala is al-ghaib, not me. So inshallah, we will get through this. We have that hope. But I think you address a point that our community has become unsophisticated in our ability to hold ideas in tension. Let me say that in a second. So we can hold the idea that Allah subhanahu wa ta'ala is the qadir ala kulli shay, right? That He is controlling over everything, but also hold the idea that we must prepare ourselves. And I think that as Muslims, as a community, if I speak globally, I think we have become very unsophisticated in our ability to hold ideas that seemingly might be in tension at the same time within our tradition, right? As we all know the hadith, tie it in trust. But my point is, I think Muslims have lost this ability to hold these ideas together, the theological, the ontological, the metaphysical, as well as the practical. So I think that's what you're seeing. However, I will say for the global ummah, in my looking at it from the United States, I think the global ummah has acted with urgency. And may Allah bless them, the scholars and activists and policymakers and physicians have come together, various forums to try to do what is a prophetic thing, right? To be able to come together and address a community issue, right? Right? And I'm not just a warner, but also bringer of glad tidings. So I think Muslims have tried to do that in many ways, and may Allah bless them in their efforts, and they continue to do that. We will need their support. So I don't think as a negative. I think that they're dealing with urgency in their different situations, so people are coming up with different solutions, or at least different graded recommendations. And we should cherish that, because there are many different things that people have to balance. I think the second thing I'll say, so on that front, before you ask me another question, I'll say there are two things from an observer perspective I'll say. One is that if we hold the prophetic mantle, and the verse I recited to you here, in Allah illa nadhirun wa bashir, right, comes to the Araf, the beginning of the verse starts with what? قُلْ لَا أَمْلِكُ نَفْسِي إِلَّا ضَرًّا نَفْعًا إِلَّا ضَرًّا إِلَّا مَا شَاءَ اللَّهُ. Right, that say, oh Muhammad sallallahu alaihi wasallam, that I don't hold for myself any benefit or harm. And so I think we need to recognize this notion that there's no benefit or harm except for Allah subhanahu wa ta'ala, right? And that we could do whatever we would like, but no benefit will befall us, no harm will befall us except for Allah subhanahu wa ta'ala. But he ends saying that I'm a warner and a giver of glad tidings. So Muslim physicians, Muslim activists who want to close and shutter all doors, your prophetic duty is to warn and guide. And ulama who are giving fatwa, your duty is to do the same, to warn and guide, and leave it to Allah subhanahu wa ta'ala. So I think this idea that we can control people's actions, or you see a lot of social media wars of so-and-so is saying this mufti is saying that, this is wrong, they're going to kill people, how could you kill people? I think this is against our tradition. And if you want to be prophetic, then hold that he was also a warner. He did not compel, but he also said, gave glad tidings to people who followed that. So I think we have to recognize the full notion of the mantle, not just this idea of people listen to me. And the second thing I'll say is an ER physician, right? So I'm an ER physician amongst this group. I worked on a Navy ship for a while for in relief. That I think the other idea from the secular world, so to speak, even in our tradition, this notion that there's an incident command structure, meaning that there's a singular voice or multiple voices, and then you stop and you let you be the channel for those voices. I think often, or too often I've noticed right now, is that Muslims want to do something, as Dr. Rania said, and what they want to do is to be that authority structure, as opposed to being the conduit to information, right? And that's it. Or to let the people who are commanding, let them command. Not all of us have to be doing thousands of webinars or saying, here's how you deal with washing hands. Dr. Munir is fine, he can do that, yeah? I don't need to also do the message. So what happens is that when you be as leaders and as activists and as scholars and physicians, start to multiply channels of communication or create new ones, we create a lot of noise and people don't listen, right? They're overwhelmed. And I would really urge us to not let this be a nafsani or an ego thing, but let the professionals do their professional things, be the conduits, but don't try to do more spinning and more of this or that, because it's only, in my view, creating pandemonium. So in the ER, we don't do that, right? We know what we're working on. There's an incident command structure. This is what we're doing, and that's my role, and I'm out. I'm not going to deal with anyone else's role. That's all I'm going to do, because we need to be able to provide those sorts of essential things. And if I'm doing something what someone else could do, then I'm taking away from my own responsibility. So I would just say that. Lastly, and I'll end here, Dr. Rafaqat, we all are equidistant from Allah subhanahu wa ta'ala, all of us. So you want to do something, make that dua, do the 2 rakat salat al-hajj. I mean, I'm serious, right? We want to do something, do that thing. You can all do it. You're all equidistant from Allah subhanahu wa ta'ala. We don't know whose dua is going to be accepted, and we must do that. And I think oftentimes we're saying, no, I'm the doctor, I'm the professional, I'm just going to do my professional role. You know what? I don't know if that's going to save any lives, but the 2 rakat that I might pray, maybe that will save greater lives. So please be holistic individuals in your response. That's my advice.
So it's a very clear advice, and that is that the Islamic approach is very holistic. And it extends beyond the physical, it extends into the spiritual realm. That in essence, we all recognize that this is from Allah subhanahu wa ta'ala. We need to take the asbab, and we also reflect on this from the spiritual perspective. Now, okay, so we've talked a bit about a number of different things there, and there's a lot more to ask. So what I'm going to do is I'm going to reflect on some of the questions and answers that are coming through now. What I'm going to do, I will sort of put them in certain themes, and I'll present them to certain individuals. There'll be some questions I will intersperse in the middle, somewhere here and there, that are related as well. So I'm going to go back to Dr. Munir. So you're the expert. You can tell us more about what the current situation is. Now, Dr. Munir, how long is this going to go on for? How long are we expected to socially isolate in this particular condition? Is there no cure? There's many, many people talking about all these wonderful cures that are coming out. You know, we may have a vaccine in 18 months, you know, take vitamin C. So there's a lot of sort of WhatsApp messages and social media messages flying in every sort of direction. Drink lots of hot water, you know, 3 times a day and so forth. So does any of this thing work from a science perspective?
Well, you're absolutely right. At the same flow, the information is being generated, misinformation is also being generated, and those are simply ridiculous when we look onto the virology perspective. For example, having hot water continuously, well, I mean, it's essential commodity for us to survive on, but it's not going to protect you from coronavirus. Having vitamin C, some people are claiming that vitamin C is going to help you. Well, vitamin C is an important part of the immune system. Certainly, it would help you in that way. But having, you know, a lot of orange juice or drink or eating oranges wouldn't protect you from the coronavirus. So as you highlighted, some people claim that having a lot of alcohol or drinking alcohol would have impact onto the coronavirus. No, that is not the case. Once coronavirus enter into your body, then it does its job the way it has to do. Doesn't matter how much water you drink or like this. So there's a lot of things that we can talk on, and those the misinformation, which is, I think, my bottom line for the misinformation is that only look into the credible sources for the information. For example, in England, only look onto NHS and Public Health England websites where you can find the credible information. Globally, go on to World Health Organization or CDC to get the credible information. And these websites, they carry on updating the latest information. For example, in the beginning, well, I was interviewed by one of the TV channel for the use of ibuprofen for the, you know, during the COVID-19. At that point, there was no instruction from NHS. After I finished my interview, after 37 minutes, NHS changed their instructions. They say, yes, ibuprofen, don't take it, take paracetamol instead. So if, the things are evolving. So once again, I would like to emphasize, stay connected and keep the information updated, and only follow the ones those are on the credible sources. Now, the next question is about for how long it would sustain. One thing is very clear, that this virus is here to remain. It's not going to go in a month, 2 months, or few months. It's almost impossible to predict for how long it would sustain, to be honest, because we haven't seen this virus before, and it is here only for, you know, I mean, it's been just three months hardly. So we haven't seen, you know, the presence of this virus. So there are a lot of new information being generated and will be generated that will guide us how long would it sustain. The bottom line for its sustainability is that this year it would have its impact in one way or other. So we need to prepare for, unfortunately, this year. And my understanding, based on my community discussion, is that government in the UK is planning for all those draconian measures and the drastic restriction up till September. Right. So September, until September is a pretty difficult time, and then probably by that time we will start seeing decline, and then slowly it will ease out.
We're looking at about 4 to 5 months, in essence, minimum, aren't we, really?
Precisely, but I think the bottom line is we all need to be prepared for the whole rest of the year. So it's not going to go anywhere out of that. And in terms of therapeutics, which you touched upon, what kind of drugs are there? Just to make it very clear, because there is a lot of misinformation ongoing that we have already recommended drugs. There is no any drug yet recommended by the authorities that can be prescribed or can be taken. However, there are 3 drugs that are getting green signal from the FDA. One is chloroquine, Another is a related salt, hydroxychloroquine. These are the two drugs being used to treat malaria before. So these are getting quite good response. However, these are not yet approved. And the other is remdesivir, which has a very broad antiviral effect. So most of the RNA viruses, they are being inhibited by this drug. So these have some plus because these were out there in the population being used. So there are chances that they would be available. Last thing is about the vaccine.
Yes.
There is no vaccine yet available. My group and many other groups, not only in the UK, but around the world, there are more than 35 different groups. Those are working onto vaccines. Every vaccine is at different stages. One of the vaccine that has passed to the phase 1 trial is a mRNA-based vaccine, which only take the blueprint of the virus. It does not have any infectious particle in it. And those were by one of the company called Moderna in Seattle in the United States. But that technology is very advanced, like you can generate in a very short time. But unfortunately, that technology hasn't brought any product in the market to be used in the last 20 years. And they have, skipped the animal testing and they went straight into the human to just expedite the process.
Let's say even if we found a vaccine which is effective, how long would it actually take for us to actually start, having a mass immunization scheme related to this? How long does that normally take, the process?
Normally, the process is very lengthy. For example, for Ebola, it started in 2004. The vaccine, the only vaccine that is approved is late in 2019. Right. So it took that long time.
Right.
But with the COVID-19, we have few advantages. First, because these are very related to SARS and MERS coronaviruses, those been circulating before and caused pandemic. So we have gathered some information very quickly. So the earliest a vaccine would become available would be around 8 months by now.
Right. Okay.
Looking onto the time scale required for the clinical trial, preclinical studies, and the laboratory validation.
Well, thank you for the good news. So let's move on to Dr. Yunus Dudhwala. So clearly, what this means, we understand that we're in a bit of a dire situation here. We're going to be expecting deaths. Now, the question now arises: how many deaths, and to what degree will our services be able to cope with that demand? And also in terms of legislation and various other sort of issues related to that. So Dr. Yunus Dudhwala, somebody who's involved with hospital chaplaincy, what's the current issue? Because there's a lot of, information going around in terms of certain legislation that's going to be probably be imposed in cremating even, people. Is there any truth behind that? Well, what's the current situation with this?
Yeah, so I think the first thing is to go back to the numbers that Dr. Munir mentioned, that even if we take a conservative estimate, I think Dr. Munir said about 800,000 deaths are expected. Our Muslim population is about 5%. Yes. We have more comorbidities in our community than others. But even if we take the 5%, you're talking about 40,000 people dying of this illness in a short amount of time. And the problem that we have within the Muslim community is, especially in the UK, and it might be similar in other countries, is how much burial space do we have? And it's very difficult in the UK to get a space, number one, find a space, number two, to get permission to use it for burial. So it's not easy. So there's not many spaces out there within the country to manage this number of deaths in a short amount of time. Anyone who's seen what's happened in Italy, and Allah forbid that happens here, I mean, bodies are being taken in army trucks day by day, because in one place, if you've got so many deaths, you don't have the freezers, where are you going to put the bodies, etc., etc. So we do have an issue. Now, the government is going to bring a bill, a legislation in front of Parliament, an emergency bill, to talk about what measures it will take during this coronavirus crisis. And one of the issues that it talks about is the burial issue or the funeral issue. And it's in there is a paragraph there which mentions that in an emergency where it might be required, that so many bodies have been have died in a day and they can't cope, then the government has the power to cremate all of the bodies and not take permission from anyone. It's an emergency measure that they're talking about in the bill. Now, it's a draft bill. Number one, it's in draft form. We have the National Burial Council, the Muslim National Burial Council in this country that is liaising with the government, that spent 2 hours with government officials on Friday speaking about this and said, we need to take this out. National Burial Council has been in touch with MPs, including Baroness Vasi, including West Street and other MPs. And Nasha has put in an amendment to say that we would like to amend this paragraph, and we need to make sure that the Muslims will be able to bury according to their particular faith. Lots of people have written to MPs, so tomorrow when it's being debated, there will be an amendment sought in that particular paragraph so that we do not come. But the issue at the moment, let's talk about now. Now we have had quite a few deaths, over 200 deaths in this country, in the UK. We have done quite a few funerals of Muslims who have died from the coronavirus. Are we able, there's a lot of questions there, are we able to wash the body? Are we able to do ghusl of the body? Are we able to shroud the body? Are we able to bury the body? Are we able to bury the body without the coffin? Now, even Dr. Munir will correct me if I'm wrong, because this virus is still, lots of things are unknown. Yes. Lots of people are scared to do something with that body. Even in the mortuaries, there is different practices. So there's a guidance which has come out from the Royal College of Pathologists, which says the mortuary can put the body in a body bag, and then the funeral directors can come and collect, normally take the body, wash the body. They should wear the PPE when they are washing the body, and then they should shroud the body, and then they can bury the body. So that's the guidance from the Royal College of Pathologists, which is there on their website currently. But the practice on the ground is that some hospitals are putting the body into 2 body bags and sealing the bag because they are scared that it might transmit some kind of illness or disease. And therefore, we cannot open that bag. And therefore, in those particular areas in this country, they are not able to do the ghusl. So they will have to do tayammum, and they will have to bury in the body bag. Again, we need to think about the numbers who attend, how many will be attending the funerals. We can't have everybody like we normally do. We're supposed to do social distancing, and we need to be aware of that. Similarly, we need to be aware of ta'ziyah. Are we supposed to go to people's houses, or can we just phone them, or can we just text them? All these things need to be thought about now so that we can prepare for the worst time, Allah forbid, when it might come later on.
I'm just going to move on to Mufti Zubair. So we clearly recognize, and Shaykh Yunus as well, that clearly there's a real need to educate the Muslim public on these issues. So at the moment, alhamdulillah, we've had a few deaths only, but this is clearly expected to increase to quite a considerable number amongst our Muslim community. So Mufti Zubair, what is the role of the ulama in this stage? We've had a couple of fatwa, we've had a couple of statements made from ulama regarding the issue of closing masajid or keeping masajid open. I'm not going to go into the details of that because I think we've dealt with that. I'm going to go more into what is the role of the ulama now in terms of looking at some of these really important issues. One of the fears that I have sometimes is that because things are moving so quickly, we can be quite hasty in passing out a fatwa. And sometimes we don't think it through too well. And that can cause a lot of panic and a lot of issues within the community. So is there a way that you would advise, not necessarily how you would deal with it, but you would advise ulama, especially those muftis who are dealing with the fatwa sort of issues in here, what kind of advice would you give them? I think let me just 1 second. We can't hear you at the moment. Yes, you can speak.
I think I have to unmute myself. Assalamu alaikum wa rahmatullah.
Wa alaikum salam.
Okay, Doctor, as you probably are aware, myself and Maulana Yunus have not had much sleep over the last 3 weeks. We wake up to coronavirus and we sleep with coronavirus. And so we have been dealing with this issue for a little while. And so myself and Mala Yunus have had a lot of exposure to this issue, right? We've done a lot of reading on this issue. We work in the hospital. We sense the mood, what's happening in the hospital, the decisions that we're making. So we're kind of like not on the front line, but very close to the front line. However, a lot of our ulama don't have this exposure. Their exposure is to their congregation, a lot not going beyond the four walls of the masjid. And so they are kind of insulated from all of this whole discussion. And so when it comes to giving an opinion, sometimes the opinion don't match the ground realities. Okay? Yes. So my first suggestion would be that, first of all, the ulama, they need to educate themselves on the virus itself and the implication that the virus is having. And like Dr. Munir said, from credible sources. You find ulama, regrettably, we know the hadith كَفَى بِالْمَرْءِ كَذِبًا أَنْ يُحَدِّثَ بِكُلِّ مَا سَمِعَ, which that whatever you hear, you can pass on Chinese whispers. Similarly, also the same applies to, you get an article, you get a video, you get somebody say something that sounds nice, but you haven't checked the veracity of it, and then you forward it on to others. That also falls under the same thing. So it has to be from credible sources. In the UK, I would say, like I said, the NHS website, the Public Health England website, the World Health Organization website. So first of all, educate yourselves on the facts. And if it's something that you find it too much to sort of all the information out there, come to us, myself and Yunus, and ask us, okay, where do we look? And we can direct you to where you need to look. So first of all, I would say the ulama need to really get with the program and understand what is going on. Secondly, we need to advise our communities of the gravity of the situation that we are in. And that leadership at the moment is missing, principally because the ulama are not really up to speed with what is happening with this virus. And then the third thing I think the ulama need to do is to remind the community of what their duty is, what they need to do. For example, our sister already, Dr. Rani has already mentioned about, the spiritual side of this, our reading the recitation of the Holy Quran, our dhikr and dua, istighfar, turning to Allah subhanahu wa ta'ala, making, bringing that spiritual light to our houses, praying our salah on their times. The ulama need to increase the durus online, getting to move on to, camp on the online world, on the social media, because that for the next at least 8 months, as the doctors have been saying, that's going to be our medium of, and the public need a reassurance. There is a sense of panic out there. There is a sense of, shock out there, and the ulama need to give a reassurance to the public that everything happens in the qada of Allah subhanahu wa ta'ala. You need to take these precautions, and inshallah things will work out for the better. And you have to give the positive messages to the community. So this is the point where the ulama need to step up to the plate and move out of their comfort zone. The things that they normally do, what they normally do is not going to work anymore. They have to move out of that, get clued up, and get really prepared to look after your community. It is very, very. I know a lot of the community is scared. They're petrified, and whilst the other half of the community is oblivious as to what is going on, we really need to get up with the program.
Okay, what I'm going to do is.
Can I add something?
Yeah, go ahead.
So I think my message to the ulama would be, we know in our Quran, inna as-sa'ata la'atiyah, right? La'atiyatun, that the day is coming. And so I really think, again, creative tension here, that the Muslims should be thinking about, yes, Allah SWT told us that the day was coming. It may not be today for me, it might be tomorrow for me, it might be 100 years from now, Allah alim. But we are very unprepared. And I work, as you know, at end-of-life care issues. Muslim families haven't talked about what they would like to do with their wills. Do they accept what type of death? I mean, none of these things. We're not even close to our parents at times, right? So I think the ulama need to say, look, this is an ishara towards a day that's coming. We need to prepare for this, right? We know this is coming. So I would just suggest that in a way that doesn't scare people, but we have to really be prepared for the fact that one day, inshallah, we will leave this world.
Yeah. Just one question from Dr. Rania in terms of the psychological impact of bereavement. Now, this is quite intense. number one, you know, the burial process. Number two, the janaza and how many people will be turning up to janaza. Number three, the issue of ta'ziyah. So how many people will be actually turning up to comfort the families? You're expected to be isolating yourself. At the same time, you need people around me. And there's a culture that we like to have people around us to comfort us. Very briefly, just tell us, how should these people deal with this? What are there any sort of, you know, important points that you can bring to us or tell us that how we should deal with this? Because it sounds like a very lonely process to go through.
It is, in fact, subhanAllah. And I think that's what we really need to, as all of the esteemed speakers have shared with us. And this is a time where we are an ummah, so it's a communal, we're very communal people, but I think the goal here is to really talk about it in a virtual sense, as in to say, while of course, janazah prayer can't be done virtually, but the condolences absolutely can be, and the ta'ziyah can be. And I think these are concepts, like we're saying, to keep phoning in on everybody who's around you and also keep checking in on them. And same with the bereavement process. That is why also counselors have taken on to the web therapy to provide this kind of grief counseling for families, but also friends and family members to do the same as well, because different people will need different types of resources. Some family members will be sufficient in their community and friends. Others will need that professional help to get them through the grief counseling that is going to happen in this very kind of unique situation that we're very isolated in. But never should we be putting ourselves in the situation of inviting folks over when we're supposed to be social distancing, as that will only make the problem worse.
Okay, Jazakallah. Okay, I'm going to throw some fire questions at you now, because these are questions that are specific and they are probably specific to certain individuals. And what I'm going to do is I'm going to open the gates and I will allow certain individuals amongst our audience to ask questions as well. So if there's anybody who wants to ask any questions, if you raise your hand, whilst you do that, I'm going to put this question to Mufti Zubair. Okay, those of us who are medically, clinically on the front line dealing with these issues, more so the males, some of us have beards. Okay, so there's a real issue about masks, effectiveness of masks, and how we can end up sort of having this virus transmitted to us. What's the Islamic take on this? I suppose, get straight to the point. Can we shave our beard?
Okay, coronavirus has thought of a lot of questions. Okay, quickly, you asked me a quick question. Last week, I was asked by my head of department himself, so he's been saying, you know, giving indications for the last week or so, because I may possibly be able to have to sort of provide some kind of chaplaincy service to coronavirus patients, as to whether I would consider, you know, shaving my beard. And after 3-4 times of asking, you're under no pressure, but I was asked the question again and again. I said, you know, just to put you at ease, I'm not shaving my beard, right? However, because I'm not involved in life and death situations. However, if you have a medic, and I've already given this position, which is something that a lot of ulama are uncomfortable with, but I'm on the front line, or just behind the front line, I would say. If you are in a situation where the illness is severe, so as to risk life or limb, and the treatment that you are going to give is also predominant presumption that you will create a cure. And thirdly, you have no other colleague there to do it who doesn't have a beard and who can put up the protective equipment. And you, for example, in one ad in London, most of the team was actually Muslim doctors. So you don't have non-Muslims on the team, or very little. So there will be occasions when you will be the only person on duty. And in any case, give it 3-4 weeks and everybody will be hands to the pump, right? In such situation where you have no hoods, because the hoods that cover all of this, I think there's a very short supply of them. So if it's in that situation, the decision is between your beard and the life and the safety of the patient, then you can shave your beard. However, it may be a case you shave your beard and the protective equipment still doesn't fit.
So, okay, so what usually tends to happen is these clinicians, they go through a fit test.
Yeah.
So to see if the effectiveness of their mask. I'm getting, because we got a lot of students of Al-Balagh who tell us this, and a lot of them are saying that they've got, quite reasonable sized beards, length beards, and they're actually passing their fit test. And there are some who don't have a beard, and they're actually failing it. We're getting all sorts of mixed sort of responses. But generally speaking, the main thing is the fit test. And another sort of approach to this is sometimes you can buy these hoods online. So, you know, if you need to buy some, you can go and buy them online. And I've had one particular physician who's done that, and he's purchased this online and he's using that, ensuring that it fits the sort of criteria. So there are other avenues that you can use, and like Mufti Zubair has already said, that if it comes to a dire situation, there are no other alternatives but to do this. Then in that case, you can trim your beard until you do pass your fit test, I suppose. Okay, right. So we got, we're going to allow somebody to speak. So we got Hassan. Okay, one second. One second. Okay, well, sorry, I'm going to move on to somebody else. We got Amaru Ismaila. Okay, so we're going to allow you to talk. If you come online and ask your question. So Amaru Ismaila. Okay, one second. This is always the case that sometimes we allow people to talk. Okay, we got somebody. Assalamu alaikum.
Walaikum salam wa rahmatullah.
We got Umar. Okay. Yeah.
My question is, since we all pray Salah at home, is it better to read Salatul Jummah at home with 4 males, or is it better, what's Awla? Is it Awla to pray Zohar Salah at home or Jummah?
Mufti Zubair, I think this is for you.
Just allow me, I will just unmute myself because you press many times, I press once. Okay. Personally, my position, right? Yesterday I signed a decree, or signed a document, another, I don't know, maybe 20 other muftis, advising that we should suspend the service in our masajid, and we should, and 4 to 5 people, you know, that do Jummah in the masjid, and the rest will read Zuhur at home. That was a compromise position for me. My personal position is that we should close the masjid entirely, no person in the masjid, let's not put anybody at risk. And when you read in the home, we are still required to do social distancing. So for me, I don't think you are able to do social distancing at home, and or physical distancing, as the word is being used now. But we don't have big enough spaces for us to do that and have 4 people do a jama'ah with the social distancing. So for me, even at home, it would be very risky for you to have physical distancing and do Jumu'ah. So I would say you should do Zuhr. And I think the government is advising now, even at home, as much as you can, keep your distance from one another. So I would say Zuhr, unless you can scrupulously, you know, fulfill all the conditions of social distancing, and then you do Jumu'ah.
This is a quite interesting question, actually, because I've even had individuals who've never led Jummah, and they're actually going home and they are leading Jummah. So they're using the minimum to do this. So it can be really problematic in that sense. But anyway, inshallah.
Let me say this. The purpose, the idea of Jummah is that we all come together and do the prayer.
Yes.
That's the fundamental idea of Jummah. And so when we are scattered in 2, 3, I don't think that fulfills the idea of what Jummah is all about anyway. And so we have a substitute in Dhuhr, totally adequate. We should do that individually as well.
Okay. A really useful, I think, quite important question, and that is the question of ethics, or clearly Sharia and the ethics prescribed from the Sharia, in relation to, Allah forbid that we ever come to this situation, but sometimes we will have to make decisions about ventilators and, you know, deciding amongst, and this is currently something that's coming out from Italy and various other places around the world, is people having to make decisions about, you know, who do we allow and put onto a ventilator, and making a decision between somebody who's young, somebody who's older. Is there a differentiation to be made here? I'm going to bring this question to Dr. Aasim initially. Dr. Aasim, do we have a framework?
Well, I think that the individual who's probably asking that question has to recognize that before your other frameworks, there are going to be frameworks that your hospital has put forward. So you're not using your own resource, right? The ventilator is the ventilator that's in the hospital. And as someone who has privileges to practice medicine in the hospital, that perhaps this question won't be an individual level one, but it'll be one that your ICU or your your hospital association has decided this is the way that we're allocating ventilators, and then you have to follow what they say. I mean, I'm not getting rid of our moral responsibility. I'm just telling you that that's going to be the factor, because it's not like you and I own any of these machines or are going to take care of them afterwards. It's the hospital system, or in your case, in the UK, the NHS might have guidance. You should know that there are guidances. So from SARS and other things, there's a huge history of responses to pandemics, of how we allocate resources. The most recent one that's been put out for this illness has been about thinking about risk, beneficial, how much benefit this ventilator would have upon people. And that's how your algorithm is to use. So, okay, well, I'm going to give this allocation of what the person's sort of disease severity is. And then based on that, think about what benefit would this ventilator have for how many days. And if that ventilator benefit does not occur in this sort of time period, then I give it to the next person. So those are the sorts of allocation mechanisms that are being talked about in the quote unquote secular world. I heard a Muslim scholar say something interesting. I'll just say this, and I think it shows what Mufti Zubair was saying. He said, we should always use ventilators for the best purpose, for the best person at all time. Don't think about age, don't think about any severe disease severity. Yes. And that's actually not how anything works in medicine, to suggest that when you're a scarce resources. So I think this shows another point of disconnect between the reality on the ground and the theoretical notion that some scholars have. But you won't have that choice. Usually physicians, it's going to be your hospital that decides, or your professional association, and may Allah protect us from that situation.
Chufanio, I'm going to allow you to talk. Okay, if you're online.
Hello, can you hear me?
We can hear you.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Sister Wafa Shufani. I work as a female Muslim chaplain. And I have two questions. One with regards training for ghusl for sisters and brothers. Is there like a special training for that? And who should perform actually this ghusl? Should they have some kind of fiqh of al-janaiz, some kind of knowledge on that, or is it open for all? Yes.
Yeah. So in essence, the question really relates that there is this fear amongst the Muslim community in terms of the burial, the janazah, the ghusl, and the whole procedure. How will that change? We're accustomed to one particular way of doing things, and now we've been told to do it another way, possibly with, and even we may be expecting some kind of legislation in terms of how we do this. So, Shaykh Yunus, are we dealing with this issue? How are we going to deal with this issue? Are there certain
it's a developing issue. So what we are trying to do through the National Burial Council is
this is in the UK, so every country will have.
So every country needs to think about what's going to happen in their own countries, and they need to be prepared. One of the questions I saw on there is about the the thinking around cremations is because we can't hold bodies for too long. The mortuaries are too small. That's not the issue. We don't even have space in burial spaces as well in our cemeteries. So it's a double issue. So we need to, and somebody's asked about mass graves. If, Allah forbid, we get to that stage, mass graves might need to be thought about as well. And there is precedence from Ghazwa Uhud as well. In terms of the UK position, the National Burial Council is liaising with the different regions to ensure that there is a representative in each region who will then take the responsibility to look at within their region who they have, even doing the ghusl at the moment. At the moment, every mosque or lots of mosques have their own ghusl facilities. In this case, we can't use those ghusl facilities because they will not be up to that standard where they've got the PPE, etc., etc. So we will have, in the regions, we will have to select one or two different areas where we'll do the ghusl, and we will have to select individuals who are prepared to do the ghusl as well, males and females. So there might need to be training provided. So we are looking at how they can be trained and they can be prepared, and we might need some volunteers in particular areas.
Okay, so okay, just one last question. I'm going to put this to our we've come to the end of our session, and I think most of our questions have been addressed. And I'll mention one or two things that are quite important in terms of what Balagh Academy is going to be doing, and I'll mention that towards the end of the session. But I just want, it's a very concerning time. You know, just sitting here thinking about this, talking to you all. You know, it's all within the control of Allah subhanahu wa ta'ala. And Allah subhanahu wa ta'ala has, you know, tested mankind in many, many different ways through history. So, you know, there is clearly sometimes a serious state of anxiety when we think about these things, when we think about our loved ones. What I really like to do is I just want all of our panelists, just one simple sentence in terms of, you know, something comforting for our audience. Our audience has come from all over. We've reached approximately 340 people who are listening to us at this moment and watching us. Any sort of, you know, really important advice, something that you hold deep in your heart that you really like to tell our audience that you consider as really important. I'm going to start with Dr. Munir. Is there anything, you mentioned a couple of points, you know, is there anything from the scientific world, you know, just one or two sentences that you think would be most appropriate before you leave us?
I really want to emphasize onto the fact of physical distancing by stating one a statement. Virus will not come to your house until you go out and bring it back to your own house.
And that's very clear. You know, that message is very clear. So this is not just about social isolation and distancing for our elderly, it's about everyone. Everybody has to play in this role. So this is a very clear message that we need to take on board. Shaykh Yunus.
Yes, so my message will be, Islam is about bayn al-khawfi wal-raja. So it's between fear and hope. In this time of fear, don't lose hope and turn to Allah subhanahu wa ta'ala. You know, it's an opportunity to make our homes madrasas, masajid, and becoming closer to Allah. Think about, you know, I was thinking today of a parallel, and I was thinking about where Allah subhanahu wa ta'ala mentions that يَوْمَ يَفِرُّ الْمَرْءُ مِنْ أَخِيهِ وَأُمِّهِ وَأَبِيهِ. People will run away from their brothers, their mothers, their sisters, and that's what social isolation is doing. We are running, and this should be a reminder of the day of judgment for us, that today I cannot sit next to my wife, I cannot sit next to my son. It should remind us of something, that there will be a day when we will run away from everybody else as well. So, you know, try and make this time a time of reflection. Yes. And just keep hope as well, between hope and fear.
So raja and khawf. So these are very, very important things that are important for our spiritual state, which impacts our psychological state, which also has an impact on our physical state. So, you know, our deen teaches us so much about resilience and how we should deal with this. Mufti Zubair, you know, any sort of last few words that you'd like to tell the audience?
I think I would like to give a message of hope, and to bring about that hope, we have to do istighfar. وَمَا كَانَ اللَّهُ مُعَذِّبَهُمْ وَهُمْ يَسْتَغْفِرُونَ. And for me, I don't think we are doing enough istighfar. If you ask the questions of ourselves, have we even started doing istighfar? So we need to do istighfar enough that Allah subhanahu wa ta'ala, He decides, okay, enough is enough, and Allah subhanahu wa ta'ala will finish it off, inshallah.
So this is a real appeal. This is a real appeal to the Muslim Ummah, that this is a trial from Allah subhanahu wa ta'ala. We must turn to Allah and we must do istighfar. We must repent for our sins, because as Muslims, this is an essential part of the cure to this illness, is that we must turn to Allah subhanahu wa ta'ala, repent for our sins, repent for all the misdeeds that we have been, you know, heavily involved with, and maybe Allah subhanahu wa ta'ala will forgive us and take this, you know, mass burden away from us. Dr. Rania, anything that you'd like to say? Yeah, we'll go to Dr. Rania, we'll finish with Dr. Aasim. Dr. Rania.
Sure. And with that, I would kind of just going right off of that, of what it would be so phenomenal if it was a global tawbah, repentance that happened, inshallah. For me, I would remind at the time of anxiety and fear, one of the most important or helpful ayat to hold on to is قُلْ لَنْ يُصِيبَنَا إِلَّا مَا كَتَبَ اللَّهُ لَنَا, that nothing is ever going to befall us except that Allah has already written it for us. And so with that, I would just end here by saying that even though these times are tough, Allah has made us tougher. Whatever He has sent our way, He has the power to take away. And if He brought us to it, inshallah, He will also bring us through it.
So part of our iman is to believe in taqdeer and qadr. And inshallah, we have full trust in Allah that we expect khair from this. It's a trial, and inshallah, we will come out better from this. Inshallah, we have full trust in Allah subhanahu wa ta'ala, but we must have sabr and traverse through this journey. And finally, Dr. Aasim, if there's anything you would like to finish off with.
So, mashallah, I think the ulama have said this. The verse that came to my mind is when Rasulullah sallallahu alaihi wasallam, the Quran says, "Ithuma fil ghar wa qali sahibi inna Allah la tahzan inna Allah ma'ana," right? That don't be afraid, Allah is with us. So even in his trial, at the moment where he felt, or Abu Bakr then felt that things were going to go bad for Islam, Rasulullah sallallahu alaihi wasallam had this hope that Allah is with us. So we should be cultivating our relationship with our Creator. I mean, you can talk to Allah subhanahu wa ta'ala every day. And I think this is a reminder for us that we should cultivate that closeness to Allah subhanahu wa ta'ala. Inshallah, we will meet Him in a good state, whatever state it might be.
So Muslims, turn to Allah subhanahu wa ta'ala. Because the asbab are there, we need to take on our asbab as much as we can. And then we must turn to Allah subhanahu wa ta'ala. If there's any clear message here, fulfill your asbab, take the physical means that you can possibly take. Remember, every action that you make will have an impact on your community, on your society. So take those measures and then have full trust in Allah subhanahu wa ta'ala. Accept His taqdeer, accept your destination, accept the destination of the ummah in this situation. And remember, this is something that's inflicting not just Muslims, it's inflicting the whole of humanity. We are all brothers in humanity. So we should look out for each other. And this is very, very important. Now, just before I finish, Balagh Academy is going to do two very, very important things. One is that we're going to continue having regular courses on the subject of coronavirus. So we're going to be addressing things like, for example, burial, educating the public on burial methodologies and current legislations and various other things related to that. We also recognize issues related to fiqh. So these are even things like, for example, different governments are approaching the Muslim community, generally all communities, in terms of some of these finance plans and so forth. Now, we need to know whether they're Sharia compliant. Can we accept them? So there's a lot of questions to be asked. So we have designed a current course which has a number of very important topics which will address the needs. There's also the question of psychology and what are the coping mechanisms that we have. There's one which is more sort of physical coping mechanisms. There are also the psychological, and also recognizing the spiritual coping mechanism. So we will be shortly, within the next sort of week, having a course that will deliver on these very important things. The other course that we are looking at also, which is again a course that we'll be hopefully inshallah be promoting over the next few days, is a course in relation to our masajid, our makatib, recognizing that these are the fundamentals of our community. And by losing our masajid temporarily and our makatib, then this has a huge impact on our spiritual state. So for that reason, Balagh Academy is now appealing to the community in that we are looking now to in a free manner, train up as many of our masajid and our makatib out there to go online and to educate their kids, to educate the public as much as possible. So we will be training people because we've got a lot of experience in doing this, inshallah. So we're going to be designing courses, really easy methodologies and approaches of how you can come online with all those students that you've had, and inshallah you can continue at least educating them and building them up spiritually. So inshallah, make dua that inshallah Allah accepts our intention, our ikhlas, and that some benefit comes out from this. Jazakumullah khair. I want to thank you, all the panelists. It's been really, really helpful, useful talking to you all. We need to keep our spiritual state high. We need to maintain this. We need to turn to Allah subhanahu wa ta'ala. This is absolutely essential. And on behalf of Balagh Academy, I want to thank a lot of the people who've been working behind the scenes, trying to get this webinar up and running. And inshallah, many of the panelists that we have here we'll be delivering on some of these sessions over the next sort of coming 2 weeks. So we expect over the next 2 weeks to talk about a number of different topics that are really useful, even, like, for example, issues related to janaza, ghusl, and so forth. So inshallah, tune in, remain in contact. We've got a lot of your contact details, and we'll keep you informed. And finally, turn to Allah subhanahu wa ta'ala. This is very, very important. And remember that inshallah, Allah subhanahu wa ta'ala will bring khair in this for all of us. We have full trust in Allah subhanahu wa ta'ala. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.